over to Kristen Carmichael and Rowie Moran and Terry, and I hope you guys enjoy your training today. And just an update as well, you guys will be getting a certificate after the training as soon as you guys finish your evaluation. We really love your feedback, but other than that, enjoy your training and let me know if you guys need anything.
Terrific. Thank you so much, Teresa. I really appreciate it. Teresa and I were just talking a little bit before this, and I think this is the 6th or the 7th webinar that we've done together in the last couple months. So really appreciate all your help with this. And I'll speak for our whole group in saying we're really excited to be here to talk to you today. We have some, I think, pretty amazing support to offer you around your teleservices. And just to be real clear from the get-go, I'm going to attempt to use the word teleservices. There are other tele-words, if you will. So there's telehealth, telemedicine, teletherapy. So you may catch me using one of those, but I'm really going to try to stick with teleservices to describe the types of programs we'd like to help you support. What other information? So we've had about 50 to 60 participants per webinar. This is our 3rd webinar. So really excited to get this information out to you. And let's go ahead and move to our agenda and look at what we're going to be talking about today. So we will be doing everything from the very basics of what a teleservices program is, what teleservices are, how you kind of make a fully fleshed out program. CVRC is here to discuss the types of funding and support that they're offering to organizations, which I think is quite remarkable. And what else? Yeah, just kind of give you a little bit of the history of teleservices and mistakes that we see, some pitfalls that we see people fall into in trying to stand these programs up quickly, as well as weighing some of the pros and cons or advantages and disadvantages of teleservices for different populations. Because we understand that although teleservices can be a very important tool, kind of out of all the range of tools that you offer, it certainly should not be the only one. Yeah. So let's see. Let me make sure I'm on the right track here. One thing that there's a little bit of data that we have from folks now, and I want to encourage you to use your chat box during this presentation. In the last training and the one before it, people were really willing to share about what's happening at their organization, and that's been super helpful. This is a space that's changing day to day, week to week, as we all kind of go through this public health crisis together. And so we're super interested to hear about what types of teleservices your organizations are already utilizing. So you potentially are using an audio video platform to reach victims of violence. Some organizations are using a chat feature or a texting with their clients. So if you can take just a second now and put that in your chat box, it'll take a minute to register and for us all to see it. And you do want to make sure that your chat box is set to all panelists and attendees so that we can all participate in this. But if you are using some of those services and would like to share, that would sure help us and be a service to the other folks who are on this webinar to kind of say what's happening around our state. And thank you so much. I see Nicole and Blaze are already here in the chat box saying that they're using some Zoom, using some telephone sessions and Zoom again, yes. Doxy.me, so I'm guessing that may be for some therapy or counseling that's being offered by Brandy's organization. That's terrific. And this is kind of a brave new world for us all to kind of jump in and figure these things out. Google Meet, thank you, Lisa, I appreciate it. Using Doxy, okay. So a couple of different audio video platforms being used. What you're seeing in this slide, if I can direct your attention to this slide, is prior to the pandemic, about a month or so prior, I want to say, CVRC put out a poll to ask their subgrantees, how many of them had some form of teleservices that they were using. And so when they got those results, it appeared that about 6% of their participants had some sort of teleservice that they were offering. Within this, the number of webinars that Rowie and I have been doing, in polling participants, it looks like now there's about a quarter of agencies who don't have teleservices, and 2/3 of agencies are using some sort of teleservices. So that's a huge shift, and a notable one, and one that happened very quickly. So I think it's really important, knowing that many of you have made this shift quickly, knowing kind of how best to support you in this change, what your needs are, and attending to those, because with a quick shift like this, we can see some circumstances of unintended consequences, and of people having to reinvent the wheel. And you know, however we can streamline this process for you, kind of take the burden off your shoulders so that you can be delivering those really rich services. That's our aim. Not to put another thing on your plate, but again, to take that off your shoulders so that you can do those things that you're so excellent at. Moving on, Mary Ellen, I'd like to turn this over to you to describe the support available through CVRC.
Good morning, everyone. Can everyone hear me? Excellent. Always want to check on the technology and make sure that everyone can hear. Because I was just noticing in the chat box that Amy was saying that they're having challenges in using these platforms related to stable technology, stable internet access. And so we want to kind of have a long conversation with all of our providers around that. So we are thrilled and excited as the Crime Victims Reparation Commission to be partnering with the New Mexico Coalition Against Domestic Violence, the Coalition to Stop Violence Against Native Women, and the New Mexico Coalition of Sexual Assault Programs to be able to support this teleservices training and the teleservices work that we know is happening statewide over the last 14 weeks during this COVID pandemic. I want to commend, and I've said this before, I know our office has been doing a significant amount of outreach with you as providers to help you pivot and create access points and points of service delivery modalities that have never existed before within your organizations. And we just want to take a moment and pause and commend all of the work that's happening to ensure access to survivors during this time. So one of the things that we have been pushing, and Kristen, you're absolutely right, we had conducted a survey, actually it was about 6 months before the pandemic. We've been talking about this for about 2 years now with our providers to learn what type of teleservices were being utilized across the state. We recognize through our strategic planning with all of our providers that severe rural isolation is one of the most significant barriers that has been identified by you as providers who are participating in this webinar today. And we had recognized that in many other areas of the country, teleservices, so counseling, advocacy, legal services, many other modalities were being used to help offset one of those barriers: severe rural isolation, access to transportation, and the list goes on. And so we had reached out to all of our providers that we fund and those that we don't fund to kind of get an assessment. And we were surprised to hear of the reluctance, right? And a lot of it comes from, and when we had those conversations, and Kristen and Rowie are going to talk about it, the reluctance is, I don't want to take on one more technology project. We are providers of service, we're working with people in crisis, and to go in and add an additional component to what we do is overwhelming, right? Technology is overwhelming. And one of the things that COVID has done for us as a state, it's been the great revealer of inequities, but it's also been the great revealer of our ability as a state to leverage resources and be able to, in an instant, take on the necessity to provide these teleservices. And so we as CVRC want to remind all of our providers that through our federal funding that supports the VOCA victim assistance, our VAWA funding, our Violence Against Women funding, our state funds, our sexual assault services funds, we can and will and have been and will continue to provide support for telehealth and teleservices in your programming. We also want to let everyone know and just remind everyone that if you have survivors who have victim compensation claims with our office who are seeking teleservices, we reimburse for those expenses, just like any other counseling or any other therapist. So those are eligible expenses under our victim compensation claims. And so we have multiple pots of funding that can support these teleservices during this time. So we want to continue to let everyone know that we are committed to increasing accessibility for survivors. We know that that in creating this point of accessibility, we have seen individuals seeking services over the last 14 weeks that typically wouldn't have sought services. So we've created an entire point of access. So we are committed to the development. We know many of you are already doing them and you're implementing them. So we want to be able to support the capacity and the longevity of this. So we want to make sure that as you continue to provide these services, that you have the support necessary for them to be successful, that you have policy, procedure, and practice to be able to do that. And Kristen and Rory are one of many opportunities to be able to do that. And we know that because of severe rural isolation and trauma and many other factors, that teleservices is one of many. And I wanna highlight one of many robust solutions to be able to provide services to survivors during this time. And it's not always successful. I know Amy in the chat box is saying, we can't use Zoom because it freezes in the middle, right? So it creates points of access for many, but it's not perfect for everyone. So we want to be able to continue to help you as organizations, and we're here and we're happy to help. And it's as easy as a phone call to our office to be able to make sure that you have you personally in the work that you do, but your organization and its infrastructure has what's necessary to be successful during this time. You are muted, Kristen.
Thank you so much. I appreciate it. That's wonderful. And, you know, really a lot of gratitude that we have this available to us in this state. I don't know, you know, I don't have my finger on the pulse of every other state, but I do work in other states and they aren't having this responsiveness to their needs. So thank you so much. And it's really, it's a terrific commitment. So I want to talk to you a little bit about how Carmichael Consultants approaches this work and some of the aims that we have for supporting organizations. And, you know, the ones that kind of rise to the top all revolve around this idea of how can we best support your organization from going, from being reactive, you know, in the moment of a pandemic and needing to stand up these services, to feeling really comfortable and confident with the solutions and the programs that you've developed. So this journey from reactive to responsive. And again, keying off what Amy was saying, that they have Zoom freezing up on them. We as service providers put a lot of time and attention and expertise into honing what I call our place-based services. So services where someone comes to your building or your shelter or your counseling center, and receive services. We have done an awful lot and spent an awful lot of time to make those really high quality interactions. So moving now to an online interaction, there will be some growing pains. There's going to be a learning curve there, and you're going to experience some things that you'd like to shift and change, and that's all part of the growth process. Now, there are some ways to kind of shorten that curve or have some help with that curve. And again, that's where Rowie and I hope to be a help to you. Having already supported projects like these, both in New Mexico and other places in the country, I think there's some expertise we can offer to help you not potentially need to make some of the mistakes that could be made. But you know, we'd like to work with folks wherever their teleservices starting point is. So maybe you haven't implemented anything yet, but you're considering it and you'd like to review your options and think it through in a more kind of focused, concerted way with some additional expertise. Or maybe you have, as some of these folks have put in the chat box, you're starting to use Zoom or Doxy or other audio video platforms. I know a couple of organizations in our state have started to use the chat function. So wherever that point is for you, I think there's ways for us to help you kind of assess and move down that continuum. We also certainly want to customize our services to be safe, effective, and client-centered. And again, to relieve this burden from you all who have so much on your plate. And, you know, keying off a little bit of what Mary Ellen was saying, where, and I worked at Esperanza Shelter for Battered Families in Santa Fe for about 6 years. So I know the feeling of, we can barely keep up with what we're doing now. How in the world would we add something? And so, you know, my aim would be that these teleservices have efficiencies built into them such that you can provide services to populations who traditionally haven't had access without it feeling like you're being, more work is being put on your plate. And I think throughout this presentation, hopefully we can explain that a little further. But there are ways to use teleservices to reach folks and to be really efficient about it, about your time and about the resource, so that you can get it out to a broader audience. And then finally, you know, wanting to focus on teleservices as a whole program, and not just a piece of technology that you're using. And in talking to providers across the state, you know, they'll speak about the platform that they're using, but a lot of times they haven't had the time or support to create the program around it. And with your place-based services, again, you've had the time to construct policy and procedure. You know what the process is. You know what the workflow looks like. And even with those supports, sometimes the service doesn't get delivered in the way that is kind of best practice or as high quality as you would like. So now transitioning to these digital services, how can we get those supports in place for you so that you have the best opportunity possible to share your expertise with folks in need? Let's see. This is the process. If throughout this presentation, if you're interested in getting the support that Rowie and I are talking about, your first goal would be to send me a little email. It doesn't have to be elaborate, but just something saying that you have some interest so that I can follow up with you and we can have a discussion about what that interest looks like. Potentially, Rowie and I could describe our services a little more to you, but really the first point of contact is to reach out to me. The coalitions and CVRC also were in line on this. So if you want to reach out to them for the support, I know that their lines are open and they're super interested in hearing from folks too. The next piece would be that we would kind of discuss with you what types of services you might be interested in. You would then communicate any pricing that we come up with to CVRC, and then we could begin work with your organization. So we hope we continue with you all as clients, but really we hope to communicate the information to you so that whatever resource you use, you understand kind of the opportunities that are out there and present with teleservices for our state and really across the country. So let's take a breath. The next piece of this presentation is really about how teleservices are here to stay. In thinking about teleservices, some folks jumped on using Zoom or Doxy during this public health crisis, you know, just to solve an in-the-moment problem, and that's terrific that folks were able to pivot that way. But now trying to get out of that reactive posturing into a really kind of planning, thoughtful space of, you know, what is the foreseeable future going to look like for us? And really, you know, minimum estimates of how long COVID is likely to be impacting your services are 12 to 18 months. And that's minimum. So we are possibly looking at a couple of years of service disruption for your organizations and for our clients. And so how do we kind of metabolize that and make plans and make programs that fit the need that's going to exist at least in the next year or two. But then also knowing that even past this public health emergency, folks are not likely to go back and retract these services that they've been creating and that people are starting to get used to using. I'm interested in knowing how many of you have used a teleservice, either telehealth, maybe you connected with your primary care doctor, or I have a couple of kiddos that see a counselor and they've been connecting via tele in order to receive those services now. So if you don't mind, you don't need to identify what services you're accessing, but if you could just say if you have accessed teleservices, if you personally have used them, that'd be terrific. And I know people have had a variety of experiences with receiving those teleservices. For example, thank you, Nancy. I got to do a doctor's visit via telehealth, and I say got to do because it was a joy. This particular teleservice was a joy in that I didn't have to go to the waiting room and sit for 30 minutes while I'm waiting for my doctor. She popped on the screen. I was on the screen with her. Literally, the visit took 5 minutes. I got a prescription called in for myself, and the rest of my day got to continue on without interruption. So that particular service was done incredibly well, and I was very satisfied with it. But I know probably others of you, Nicole, you're saying you've accessed the service, are using it, and with varying degrees of success. So here on this slide, we have some other examples of what was happening across the country, even pre-COVID. Now that we're where we are, certainly there are many more examples. The reason I presented you with these examples is because I wanted you to see just how creative people are being with teleservices. Really, the options are unlimited as to how you can use this tool to expand your ability to reach certain populations. So for example, if you look at Arrowhead Telepresence Coalition, they are kind of virtualizing, if you will, chemical dependent services and the services of pharmacists, and then porting those services to county jails, schools, tribal health and human services organizations. So again, populations that oftentimes are denied access or don't have equal access, and this being a method for getting those services where folks deserve and need them. And then one other that I want to key off of is USC Teleservices. And so what they did is they set up a partnership, USC set up a partnership with some family resource centers such that clients could go to the family resource centers, use what they're calling TeleSuite, and connect to their therapists at USC. And the reason that they did this, and it's a solution that I imagine would work in our communities in New Mexico, are that many times our clients don't have a smartphone or access to a computer that they can use safely. And so like I'm dealing with another client in Arizona, a behavioral health client, and they have what are called telemed rooms. And so clients can come use their space and their technology to connect to offsite specialists, therapy, what have you. So there are ways to kind of, there are ways to get over some of these hurdles and challenges that present within client populations. Okay. Good, it looks like some of you are describing some of the telehealth appointments you've had. So I'm going to take a minute while we read this slide. And it really comes back to kind of the voice of victims and what's best for them. And this is the voice of one victim that I found on a blog that was posted on the internet. So let me give you a minute with this, and I'll take a breath too. So first of all, Amy, Nicole, and Lizette, thank you so much for chiming in about kind of your experience with your teleservices. That's really helpful. And then something that I want to kind of key on in this particular slide is just this, again, this individual victim's reporting of the fact that after she had been abused or victimized, then she needed some time to isolate, in her words, and that she was afraid of big groups. And you know, having worked in domestic violence, I do see that sometimes there's a continuum of healing. And so somebody being victimized and then being asked to come into shelter or go to group counseling at an administrative office can be intimidating. And so, you know, wouldn't it be wonderful if we could offer these services in the home where people can, in some ways, maintain a little more anonymity and a little less kind of new and intimidating environment, so they could have it ported into them instead of them being expected to go seek it out in their community. So I see lots of value in that, again, as one tool of a number of tools perhaps that you're offering based on who your client is and what their wants are. And one other piece is just, sometimes I hear folks talk about teleservices like if they started offering teleservices that all of their services would be via tele, and that is not the case. So what I believe will work in this time period is having kind of a mixture or a hybrid where over time you're able to offer some in-person on-site services, but you also have teleservices as an alternative. So again, it's not an either or kind of distinction, but a both and. And so that's how I like to look at it. So this slide is depicting, again, why teleservices are here to stay, which is the real critical importance of victims getting services as early on as possible and having them be consistent. And we know when folks don't get services early on, or they're not consistent, or they don't get services at all, what types of bad outcomes there are on the horizon for individuals and families and children. And so you see what the bad outcomes are when access is denied, or the hurdles are too big, or the service isn't there for them in the way that they need to consume it. But on the left-hand side, you see these, what I'm calling access disruptors. So these are the things that get in the way of folks accessing services. And right now, there are more than ever. I mean, even before this pandemic, there were an awful lot of things that could prevent folks from getting services. But COVID-19 and all of the things that come along with it have really heightened those for survivors. And I've labeled a bunch here, but everything from folks not having transportation to the fact that many times victims of domestic violence, their offenders are home and watching them now in ways that perhaps they weren't. You also have different communities like folks who are deaf who have been shown to prefer online services. You have people living in smaller or even medium-sized towns where there's stigma attached to perhaps someone seeing your car in the parking lot of a nonprofit organization and knowing that you're receiving those services. And certainly we wish the stigma didn't exist, but acknowledging that it does, and that there are so many communities in New Mexico where folks know what kind of car you drive and can make judgments about you based on that. So this is a graphic showing how many things are going on around social service providers these days, just how complicated their world is, particularly folks who are delivering frontline services. There's an awful lot of complexity that has been ushered in recently that isn't likely to subside for some time. So you have providers grappling with trying to stay client-centered in the middle of everything that's happening. All of the safety issues that are present, including potential infection from this disease. You have stress and fear about everything that's going on, different information from our government about what we should be doing, workflows changing, people trying to work remotely from home, other folks not being able to, clients having different shifting demand on what they would like, remote work, as we said, and even the financial impacts that can be happening at the individual level and at the organization level. So there are some ways that teleservices can alleviate some of this. Again, and we have a slide coming up saying teleservices are not a panacea, which is the truth. But there are some ways that they can mitigate some of this and give you some wins in the midst of what can feel very overwhelming. So this is the last slide describing why it's important that we pay attention to teleservices and why it's worth your time and the time of your organization to be thoughtful about teleservices as a mainstream, long-term solution that you offer, not just as something that we're doing to kind of get by in this really difficult time. So again, the impact of the pandemic for the foreseeable future, or at least 12 to 18 months minimum, and the fact that even after it's over, we're not going to go back to business as usual. I mean, other providers like healthcare and counseling services are making this transition, and they have no intention of going back either. So to kind of keep pace, to stay relevant in the lives of our clients, I mean, we think about younger generations and how in tune and pervasive technology is in their life. To think that we will just go back to place-based services is really not realistic. And honestly, I think there's so much opportunity here. Why would we want to do that? How can we embrace this new future in a way that opens the doors of our services, streamlines our services, makes them more efficient, helps them to reach the folks who maybe need it the most? That's really exciting for me. So I hope I'm communicating that message of it's not, you have to do this or else. It's really, this is a terrific moment to realize something new for your organization and something new for victims. Great, now I'm going to turn it over to Rowie and let him give you some background on teleservices and the ways that they can, again, be helpful in the work that we do.
All right, thank you, Kristen. So we're going to talk a little bit about what teleservices are, and a good place to start is by giving it a short definition. And the definition is very simple, meaning any kind of service that you offer remotely is a teleservice. And in healthcare, this is sometimes called telehealth or telemedicine. In psychology or psychiatry, this is called teletherapy, and as a general term, we can refer to that as teleservices. In social services, you can think about teleservices as a connector that connects several nodes to one another. So one node or one focus would be the provider, the service giver. Another one would obviously be the client. You'll be connecting with the client, the victim, in some cases the patient, through some kind of remote service. And then in many cases, when you do case management or follow-up, you'll be connecting with community partners. Let's say you've seen a client for therapy and now the client is in need for legal advocacy. You may get somebody else involved and you may use teleservices to make that connection. And finally, in some cases, you're going to be referring your client to a specialist which will create another point of connectivity, which you can address using teleservices. Another aspect to that is you can almost imagine another arrow from the provider to themselves. And that means that you can use teleservices to also virtualize your business. So it's not just an external service that you offer your clients, but this can be a set of tools to virtualize your internal operations. You can think about case management meetings. You can think about your billing operations, your front desk, some of your intake and waivers. You can use this similar tools to virtualize that as well. So let's move on to the next slide. All right. So given that, you know, telehealth, teleservices, telemedicine can do many things for us, it makes sense to think about some of the common services where we see teleservices apply in the context of social services. One area that we see many organizations beginning to offer is therapy, either group therapy or individual therapy. That, you know, sound sometimes like a straightforward offering, right? I mean, you can perhaps use something very similar to the tool that we are using now, Zoom. But those of you that have experimented with teletherapy, you probably know that in addition to the technology, you also need to think about some of the clinical realities, meaning if you have a therapist using a teletherapy tool, the technique of forming, you know, diffusing the client initially, forming an environment of safety and trust, that technique needs to be modified a little bit. You know, a very simple example, I'm speaking with you right now, but I'm not forming eye contact. So this is something that in teletherapy we need to think about. But this is a fairly common service that we see organizations offering. Another element is case management. So this idea of providing advocacy, peer support, following up with your client, connecting your client to other partners in the community, other service providers. This tends to be a good candidate for virtualization and teleservices. Community outreach, offering training, empowerment. This is also something you can virtualize. Hotline services, legal advocacy. An interesting category is the internal staff and coordination, meaning especially in a you know, state like our current state, the pandemic, where the virtualization is not just of your external services, you may have staff working remotely. That means that teleservices become useful to virtualize your internal operations, not just your external offering. And finally, those of you that offer psychiatry or other health services, or perhaps sometimes you connect virtually with a specialist, you can use teletherapy tools for that as well. In industry jargon, it's many times called a teleconsult, meaning it's not necessarily a full session of telehealth. It's a mechanism for you to send out information, ping a specialist, and then get something in response. So these are a few key services that we typically see as good candidates for virtualization. There can be many more, and each service, we're going to talk about it in a little bit, each service, when you think about how to virtualize this, how to virtualize it, you really have to analyze it in detail in terms of what goes into the service, what's effective, and also what kind of operational support is needed to enable that service. All right, so a few modalities, and The reality of teleservices right now is that this is an emerging market. It's an extremely diverse market. So the market offers many solutions and many services. Perhaps, in a decade, we're going to see these things kind of converge into a few key offerings and a few key players. But right now, we have a market that's extremely diverse and fragmented. So one modality that's fairly common is, video. You can think about Zoom, you can think about Doxy, just audio video solutions enabling communication between a provider and a client. These solutions are sometimes bare bones, and Zoom perhaps is somewhat bare bones. In other cases, these solutions connect with your digital record system, with your electronic health record system, or those of you that have client portals where a client can go online and register, or perhaps make an appointment. So some solutions connect with those portals instead of being offered independently, but basically it's the same modality of enabling video and audio chat. Another modality that we see more and more of is chatting and texting. And that means that some services, and you see this quite a bit in behavioral health nowadays, maintain continuity of service beyond the video session through chatting and texting. So you can think about a situation where you had a therapy session with a client, you gave the client some exercises to do, a few things to think about. You can use a chat service to follow up on that. The more sophisticated services would then record the responses of the client in a digital record system, which would allow you to review the case and assess the progress of the client. The more bare bones services would simply enable a text conversation. A similar idea is also chat services. Typically, those would be offered through a client portal online, where, again, beyond the video session, we give clients and survivors the ability to communicate with their service provider. Finally, it's an emerging market, so there's a wide category of other. And in that other category, you've probably seen some of those. Perhaps you've seen telehealth pods or suites when you go to places like CVS or Walgreens, some of the bigger ones, where you can go into a pod and in some cases you can do medical exams using remote services that are in the pod. And then it transmits the information onwards and somebody can get back to you. Remote monitoring services is something we see quite a bit. Blood pressure and insulin measurement services. Clients take that with them. It transmits the information to a provider out there somewhere, analyzes the data, and then we can facilitate interventions based on the data coming from the client. Another interesting service in the other category is remote ICUs, and I think this is actually in the news nowadays. I think you've heard about the shortage of ICU beds. The reason ICU beds are so unique and go beyond just an inpatient bed is that in the ICU, the patient has to be connected to many monitoring devices, and somebody needs to do the monitoring and analysis and decides what kind of intervention is relevant. So a solution that gives us additional ICU beds without actually having all the equipment in one place is a remote ICU. So we see rural hospitals nowadays being connected to remote monitoring devices. All the information is being sent to something that you can imagine almost being like a war room or a command center, that can be quite remote. You know, it can be hundreds of miles away, but the intervention is facilitated based on the data coming from the remote ICU. So many offerings out there, and let's just, you know, as an illustrative example, let's look at a few of them. So one is teletherapy, which you know, can be fairly simple. The therapist and the client connect to a video service. You know, the more sophisticated services can also enable chat and text, but you know, at the bare minimum, this is a video service. Remote monitoring, the guy there in the picture is connected to a blood pressure monitor. He can see the results, but then the results are also being transmitted to a provider somewhere, and the patient can see the analysis. And finally, you have consultation pods. Some of you have seen those at, you know, at drugstores around the country. You go in and you facilitate, and you have a basically a telehealth service being facilitated, where you connect to a provider. Can be a specialist, can be a primary care provider, but you connect to a telehealth kind of service.
Well, and if I can add to this, Rowie, you know, some of these are more healthcare type solutions because healthcare has really invested in telehealth and then the origins of many of these services. But just kind of being creative to see how, as a social service provider, you can piggyback off the capacity that it provides you. So, for example, you know, the picture in the middle where it's saying there's kind of remote monitoring and follow-up. I mean, how many times would we love to have more access to following up with clients, but for one reason or another can't make it happen? And many times the reason it can't happen is to ask the person to come back to us just to tell us how they're doing. It sounds pretty extreme, and it's an awful lot of burden to put on the client. But what if we were enabled in these ways like Rowie described, to be able to quickly check in with folks, see how they're doing after we discharge them from services? How much more effective could we be at helping people who start to struggle, sometimes pretty immediately after we discharge them from services? You know, we could wrap them back up and with, you know, perhaps less intense services, kind of get them back on the right track again. So lots of opportunity here beyond how healthcare is using these tools to apply them to how you're doing your services.
All right. Thank you, Kristen. And I wanted to talk a little bit about how to put together a program should you decide to offer teleservices to your clients. So a few things to keep in mind before we get into the process. I would say the most key idea to keep in mind is that this is not just a technology project. And in fact, the technology can be the easier component of developing a teleservices offering. Many of you are currently dabbling with teleservices technology, and you've probably seen that the contracting process with the you know, suppliers and the implementation process was not necessarily very challenging. However, as with many technology tools, they are as efficient and as effective as your operations, services, and motivation behind those services to support the technology. So a few things that, you know, we've seen as critical to make this a success. One is training, and this is training for both clinicians and for your internal staff. Why is training required? So this is not just training of, you know, this is how you access Zoom, but as in the example that I described, which is a real example from a you know, a client that I worked with recently. We've implemented a teletherapy system across about 250 therapists. And the training component was very important because the training involved not just using the technology, which was easy, but also retraining on how to conduct a session virtually, how to make eye contact, especially if you decide to apply this to therapy with children. How do you put the children at ease without being able to be there in person and perhaps play a game together? And there are ways to do that online, but you kind of need to think about it, design it, and then build a training around it. I'm going to talk a little bit more about operations, but in the same manner, let's say you virtualize your services. Now the client is not coming on site, so your intake, check-in, perhaps form signature process, that has to become virtual as well. So your support personnel needs to undergo training to function in the new environment with the new process. Which leads me to process design. So when you virtualize these services, you're going to be virtualizing the administrative processes around your services. So you have to document and adjust your process. If you're changing now the way your front desk or your check-in process or even your billing process is going to function, you have to document, redesign, and build training around it, and make sure that your technology is going to support the new process. Then, as a third component, as you may imagine, there is the technology deployment component here, which means selecting a vendor, contracting with the vendor, making sure this is the vendor that's right, for you and your needs. Depending on the complexity of your organization, there's going to be a process of, as you can imagine, configuring new users, making sure everybody has access, making sure that you test this. I would say an interesting component of the technology is that there's sometimes it's sort of like a magnetic force of technology. You implement one form of technology and you find that you need to implement something else, meaning think about things like VPN. You may discover that given the new technology, you're now allowing everybody to access your system from home. You'd like perhaps to protect the access, so you may insist on everybody accessing the new technology from your network, meaning you're going to be implementing a VPN service. So sometimes, definitely not in each and every case, but sometimes you'll discover that the new solution also necessitates thinking about additional technology solutions. Finally, an interesting category here that I think is especially relevant to us here in New Mexico is aligning with our partners and with the rest of our community. And this is an opportunity. I mean, right now, if all of us are thinking together about teleservices, and we sometimes work in concert because we connect clients from one organization to another, then it makes sense to implement teleservices while remaining conscious of what others are doing to make sure that we provide a consistent experience to our clients. So let's talk a little bit about how to do this. And Kristen initially mentioned that, some folks may have a technology fatigue. I mean, many of us have been through painful technology implementations. Fortunately, this is not one of those implementations. So, I mean, I'm not going to say that this is something you can just kind of ram in without thinking about the repercussions, but this is not, if some of you have implemented ERPs or EHRs or digital record systems, this is not as complex. I mean, this does not even come close. So, so we can take a breath. However, I mean, the process does involve a few steps. It does make sense to, and this is, here it's sort of, tested and tried by, live clients out there. So, so this is a best practice. It does make sense to begin with analyzing your clinical processes, analyzing the services that you currently offer. And even if you don't think about it like that, each and every one of you has a menu of services. Some of these services lend themselves more to virtualization. Some of those do not. A good example is, sheltering. A shelter probably cannot be virtual because somebody needs a physical bed. But services like legal advocacy or psychology or therapy have a better potential of becoming virtualized. But as we said, a few slides, slides prior to this one, when you decide to virtualize a service, you should also think about now the new rules and policies behind a service, because you may need to change the service a little bit. The next component, the next step, is to think about the operational impact. So let's say we decided to virtualize therapy, and therapy typically involves clients checking in person. So now you need to think about what this check-in process is going to be like when it's completely remote. I know that some of you like to provide your clients with forms to kind of assess assess their state, their situation prior to receiving service. In therapy, some folks like forms like the PHQ-9, right? The depression questionnaire, or the GAD-7, the anxiety questionnaire. But if you're virtualizing this, there's no questionnaire. So you need to think about the process of doing this in a virtual format. The next step is to think about the confidentiality and regulatory requirements, which means HIPAA, it may mean privacy, it may mean other specific regulatory requirements of New Mexico. And also, if you have special or specific funding sources that mandate certain rules, you need to take those rules into account. With all of that in mind, then comes the process of, what's called in technology jargon, the building or putting together the requirements. We translate everything into a set of needs, criteria, requirements. We take that and go to the market with it. We scan the market, we see what makes sense. We then rank based on these requirements. We rank the offerings one against the other. Typically, you zero out on 2 or 3 offerings, which leads to the final component, which is to analyze the costs, doing some price modeling. In many cases, you can negotiate with these vendors. Especially if you have enough heft size and project size that comes with it, and then you can identify the appropriate solution and move on to the implementation. Something to keep in mind is that there's no need necessarily to do everything simultaneously. So we talked about identifying the services. You may say, you may think, now, this is the pandemic situation. I would like to address first the services I need the most, the services that are most critical to offer virtually. And later on, I'm going to move on to virtualize more. So you may treat this in a modular kind of fashion. You may begin with teletherapy. You may then proceed to examining your intake forms and virtualizing those. Maybe then you'll address case management and outreach, and finally you'll virtualize some of the follow-up services. It does make sense, though, to compose that menu of services at the very beginning, just to make sure that the solution that you may select is not going to be found deficient when you do get to virtualizing the other services. But you can implement them, in a modular fashion, one by one, which reduces stress from your organization.
Terrific. Thank you so much, Rowie. So this slide, for those of you who want to go on and continue with us to become a client, I wanted to make very clear some of the services that we can help you with, just so you can identify if this is something you'd like support with. And I tell you, we just started working with a few clients, and so we're starting to identify more ways that potentially we could support social service agencies in New Mexico. So this is not a comprehensive list, but some of the initial ones are, again, like Rowie was saying, helping you pick those services that are the best candidates to virtualize, to bring, to make teleservices, if you will. Also, helping you flesh out your program development. Again, so like we were saying, it's not just about picking a technology, but about creating a whole program. And so that may include making offerings to you about policy and procedure that you may want to incorporate, or workflows, or different ways to construct your process differently, making some recommendations to you around that. Also, helping you know what the technology offerings are, and helping you assess what might work best for the given service that you're looking at changing. Training staff to kind of make sure you're all on the same page and moving forward. Implementation, so that could include a number of things, but one valuable component is making sure that you test your solutions before you kind of go live with them. Certainly there are bugs to work out, and you'd want to identify those things before you offer them to clients. And again, to repeat something that I said earlier in the presentation, but I feel strongly about, is that we've done a lot over a really long amount of time to make on-site, place-based services work as well as possible. And so when you start teleservices, giving it the time and attention and thoughtfulness that requires, and not having an unrealistic expectation that, oh, we'll get on Zoom and we'll do the same thing that we did before. There really are different types of skills and ways of using this technology that can make a difference for the quality of the experience that you're able to provide. From a personal standpoint, I hate to see folks, take a step out to try something new, and then, maybe not have the best initial experience and, kind of throw it all out. Certainly there is a learning curve here. And then last is an offering to you all to provide some ongoing support. So even after you implement your program, we're interested in ways that we can be helpful to make sure that that program goes well for you, that it's what you need in order to do the amazing work that you do. Oh, and last is to reiterate what Rowie said, that although we're presenting you with an awful lot of information, it may feel like you're drinking out of the fire hose here. This is a project that can take 1 to 2 months. I mean, that's our hope, is that we can get people up to where they'd like to be and resolve whatever issues they bring as needing help with, and have that completed in 1 to 2 months. So some time and effort, but not an extraordinary amount, like potentially if you have some, if you went to digital files or something like that, that's a bigger project. So we're kind of rounding into the last a third of our presentation, maybe even less. So if you have a question on your mind right now or something that you'd like to offer the group, please go ahead and put it in the chat box. I may not get to it. Rowie and I and Mary Ellen and Terry may not get to it until the end of the presentation, but I hate for you to wait and us not get to something if there's kind of something on your mind. So let's go through some of the pros and cons of telehealth or teleservices. And so this is a slide talking about how they are not a panacea. There are certain groups, there are certain circumstances where this is not an appropriate intervention. And our organizations tend to be really good, or hopefully are aspiring to be really good at being able to tell what each individual client needs. And so it is important with this tool, as with any tool that you might offer or use to assist a client, that we take the time to figure out who this is appropriate with and who it's not, make that distinction, and then proceed accordingly. So again, the issue with bandwidth, and I know that's an issue in our state, I think there is some wiggle room there to use kind of the telepods or telesuites or telerooms to assist those who may not have the bandwidth or access to the technology they need. But this is still a hurdle for us to get over, and a need for us to use a different service potentially. So, of course, some folks having difficulty navigating the technology, needing, again, to respect safety and confidentiality, even when we're in this online environment. And there are, some people have brought to light concerns around clinical effectiveness of providing services via tele. Now, I'll present you with some research that says that teleservices are on par with in-person services when it comes to quality. And I know Rowie has a great example of this. There are different skills to develop so that you have the same amount of engagement and impact via tele as you might have in person, because there is a difference. But there are certainly some skills and some tips that will help you bridge that gap. Rowie, did you want to give any example on that? Oh, I think we got you on mute.
Hey, sorry, I was on mute. Yeah, so I think it's important to keep in mind that each of these services, or each of the services that you decide to virtualize, is going to be as effective as your analysis and decision behind it to make it adapt to teleservices. So you can think about perhaps again, things like therapy. They may lend themselves to video communication, but to make it effective, you're gonna have to change them a little bit and come up with the rules to make it more effective. In some cases, you may decide that this is just not the right service. I mean, I do have a client that decided that therapy for clients under the age of 8 is not going to be provided through remote services, because their method of providing therapy to children really relies on playing together, and it's very difficult to do remotely. So I think it's just something to keep in mind, that this is not going to be a panacea. However, it also doesn't mean that you are compromising on the quality of your services. You just need to make sure that you adjust the service so it matches the new modality.
Terrific. Thank you so much. And certainly the last point on this slide, there are challenges inherent to offering a new service, whatever that service is. And so again, like I said, getting up to that cruising altitude takes an initial kind of push and an initial effort. And so this is more of the pros, the advantages, and they're considerable. The first one maybe is the most important one, although many of these are really important, particularly now. But that access piece, we know even before all this, even before the pandemic, before everything happened, we knew there were people that we weren't reaching. And with what has happened in the last few months, that has just increased. And so what do we do to be client-centered and to respond to that need? And I think teleservices is a really strong answer for that. It certainly facilitates remote work so that we're not putting people in jeopardy for their health, and different ways for it to reduce the cost of care, the amount of time that things take. There's minimal startup costs, and as was discussed at the beginning of this presentation, for CVRC subgrantees, you know, there's some funding for this, so it's a really amazing time right now to take advantage of the resources that are available. Again, this point about the future demanding that you have these services, there will over time become an expectation on you as a provider that you have these services. Just the client-centered nature of it. I attended the training last week with Jill Davies. I don't know if any of you got to be on that, but it was terrific. And she talked about client-directed safety planning. And I think of this as also being client-directed in that you have clients asking for it. And so, you know, understanding that there's some time and effort and resource that goes into it, but how do we honor those requests of our clients and make sure that we can deliver? And then, you know, certainly this gives you the opportunity to evolve your care in really creative ways that without teleservices, you do not have those opportunities. And easing those fears of stigma for your clients. And again, this idea that, you know, much of the teleservices we're talking about are ways for you to connect with clients, but what about also your internal needs to coordinate with your staff, to have staff meetings, or to have case staffing, or to have meetings with your partners, or, you know, if you have any kind of multi-system meetings that you're involved with, teleservices can also provide, and the technology used for teleservices can also provide you that capacity. Okay, so this is a little bit of research that I wanted to present to you, and certainly there is more research needed in this area. But you know, all of the projections for the future is that more and more folks are having issues with behavioral health, as well as substance abuse or dependence. There is a woefully low number of folks like yourself out there to support people with these kinds of struggles. And, you know, the cavalry is not coming. So how do we make do with what we have and serve the greatest need that we can? And so initial research is showing that teleservices are and can be very high quality services. Now what Roe said is so true, that whether or not your teleservices are high quality in many ways depends on how you formulate a program around those services. So if you take anything with you, please take that you know, it takes time and attention and frankly some expertise, I think, to put your best foot forward in this way, in this new area of service provision. And we hope that this information you're being provided today can help you with that. So not to go too much into this slide, but just to recognize that each of your organizations has regulations that you're being asked to abide by. You have certain funders that ask for certain information from you. You have likely some confidentiality requirements. Some of you do, some of you do not. For those of you that do have confidentiality requirements, they could be quite intense, even above and beyond what you see in healthcare, which is HIPAA. So for, you know, if you work in an organization that does domestic violence or sexual assault work, or if you work for a drug and alcohol or recovery treatment provider, or if you work in the behavioral health realm, there are some significant differences. And so how do we make sure that we're picking solutions that kind of ground us in these different regulations and confidentiality requirements? And then really kind of coming to a conclusion here, some of the common pitfalls that Rowie and I have seen with organizations going to deliver teleservices. This is a list. One I like to talk about, and I think I already have talked about a little bit, is again this idea of folks kind of thinking of it as a technology-only type project, attempting it from that kind of vantage point, and then having poor results and wanting to abandon the program, or thinking poorly of teleservices. You know, perhaps they have some bad experiences, or their clients have some bad experiences, and then nobody wants to do it anymore, and it becomes a really tough sell. But I think with the proper support, again, through Rowie and myself, or through other resources, I'm going to show you a resource page next of some really great resources. You know, how can you avoid that and not need to go down that road, and really feel the success of starting a new endeavor, and keeping folks excited and motivated about it, and sharing that with your community. Rowie, was there anything else on this slide you'd like to address? I know we've got you on mute again.
I think we covered it. Again, I mean, if we just think about the process of the 5 steps, I would say that the most common pitfall is ignoring those steps, which, you know, then may bring surprises. Once you have a tool implemented, you know, you discover, oh, I mean, it actually cannot support services 1 through, you know, 4, and it may support some of them, but now we have an issue with the operations around these services, so we need to go out and get something else, which, you know, just ends up being a waste of resources and time.
Yes. So these are your next steps, and I think I told you your resource slide was next, but we do have a couple in between. I apologize. So next steps are one opportunity, again, is for you to email me in order to say that you're interested in some sort of collaboration or partnership, and or at least interested to see if that might be a possibility. And we can have a discussion. This slide says, again, what some of our services are and the ways that we would like to support you. So if you continue on with us as a client, these are some things that will be made available to you. And I know Mary Ellen has said that CVRC has funding to help you all be able to fund such an effort. And then I do want to make sure that you have these additional resources. And some of these are really terrific. They have toolkits. There's all kinds of online resources available from these national organizations. They give kind of best practice information. And this is a space that's changing even day to day. So Rowie and I are kind of keeping our finger on the pulse of these types of recommendations that are coming down the pipe. But, you know, people are having these new experiences and learning all the time about what works and what doesn't. And then finally, we have time for questions and answers. And before we get to that, though, I do want to give Terry or Mary Ellen anything else that you'd like to say to kind of, in summary, or about CVRC support.
Sure. So I just want to thank everybody for attending and taking the time from your really busy schedule. We know that folks are being pulled in a lot of directions to be, you know, providing services. And then also, you know, even before this presentation, and really when New Mexico got hit with its first case, we were getting responses from a lot of service providers really being proactive in how to continue services. So just a lot of gratitude for our service providers and being really strategic. And I think also just mentioning that, which was already discussed in this presentation, is there are challenges in, you know, in teleservices, right? So it's not a one kind of solution fixes all. So just really appreciating that message, because we are still facing those challenges of rural isolation and challenges in receiving technology. But we are, CVRC is here to be able to help and partner, and so we're just really glad to be part of this conversation to really use Carmichael Consulting as a resource, and just thank you all for all the continued work.
Thank you so much, Terry, and thank you all for joining us on this webinar and being so interactive, and really appreciate the work that you're doing in our communities to keep us all safe and healthy and having happy lives. So anything that we can do for you, if you have any questions, I think we got a few more minutes. We're all available to you, but really just so appreciate your work. And, I know with the partnerships we have with CVRC and the coalitions that, if you feel like there's a barrier to you using these services or getting the help you need, we are all committed to helping you get over those hurdles. If they're financial hurdles or administrative hurdles or whatever that might be for you, regardless of your size or how far you might be in developing teleservices, we're here to help. So thank you.
And just an update, thank you, Kristen, and Terry and Rowie. For those of you that logged on after I made my announcement, just letting you guys know you guys will be getting a certificate today or tomorrow for participating today and completing the training. So keep an eye out for that. And there should also be a survey that pops up as soon as you exit or leave the training today. If it does not pop up for you, I will send it via email. If you guys can take a moment to take the survey and the evaluation, as it means a lot to us at the coalition and for CVRC to make sure that we are addressing the needs of the community and what other trainings you all need and how we can support in that aspect. But other than that, I just want to say thank you to Rowie, Kristen, and CVRC, Terry and Mary Ellen for this partnership and in funding this training. Thank you so much. We really do appreciate it at the coalition.
Thank you, everybody.
Thank you.
Well, does anybody have any questions at all in the chat? And you can also, as I mentioned in the previous one as well, I will also attach Kristen and Rowie's email if you have any questions for them directly to that email address with the survey and any other information that you guys would like me to add. But I can add their email in there just in case if you guys have any questions that you can't think of right now, but maybe might come across later. So I'll also provide that in your email if that's okay.
Terrific. And I want to make sure that Amy gets her question answered. She's checking to make sure they will have access to the information in the program. I wonder if we're talking about the webinar PowerPoint, Teresa?
Maybe.
Or Amy, if you want to, yeah.
Okay, yeah, I can definitely send the PowerPoint. I include that as well in there. And we are also recording today's webinar. So I will also, once I download that onto the computer and edit it, I will send that to you guys as well. I'll upload it on our YouTube channel for the coalition, and I'll attach it to your email. So you guys have that to reference back.
Terrific. And then I see that Samantha wants to make sure she gets the links of the additional resources. And so this is a part of the PowerPoint. Samantha, so when you get the PowerPoint, you've got your resources.
Right.
Thank you for asking for that. There are some really great ones in there. The National Network to End Domestic Violence Tech Blog and Toolkit. I know it's specific to domestic violence, but it can be kind of, it's bigger than that. And I think it could help an awful lot of you kind of think through some of what you're doing. Great.
Good night.
Thank you all.
Everyone. Just can I make a final word? I apologize. Teleservices at its absolute best. Even when we plan these, we have survivors seeking our assistance in the middle of conducting teleservices. So I appreciate Terry being on this, Terry Mijares, but I just wanted to conclude by letting everybody know, again, CVRC is absolutely committed to ensuring that you as providers have all the resources necessary to deliver services to all of our most vulnerable populations, and that includes teleservices and the in-person services and all of the services that you provide during this pandemic, which has been just phenomenal, as it always has been. And we continue to be a survivor-centered state, and this is one of those additional tools and resources that we want to make sure everyone has complete access to if they so choose. So we can make it available to them as providers, and our survivors can choose the modalities of services that are most successful for them. So again, thank you to all of the work that all of our providers have been doing during this time. We know that the work is hard and that work is heavy, and we're doing it in our homes in ways that we never have before. So please continue to take care of yourselves during this time.
Thank you, Mary Ellen. So it looks like there's not many questions, and I think that, you know, it's 11:27, getting ready, you know, closer to lunch. And so if there's not any more questions, I will say have a great lunch. And again, thank you to Roe, Kristen, Terry, and Mary Ellen. Very much appreciated, and it's a pleasure working with you guys. I hope everybody has a good day.
Bye-bye.
Bye.